I'm Edward Moorfield. I'm the publisher of Citybiz, and I'm honored today to interview Deirdre McGinley, who is Executive Vice President for the American Institute for Cancer Research. Welcome, Deirdre.
Thank you very much. Pleased to be here.
What is the mission of the American Institute for Cancer Research?
Well, the American Institute for Cancer Research has a very powerful and unique mission. We champion the latest and most authoritative scientific research from around the world on cancer prevention and survival through diet, weight, and physical activity so that we can help people make informed lifestyle choices to reduce their cancer risk. One of the most important statistics we know is that 40% of cancer cases in the US are preventable. And so we really are aiming to fund the research that helps us know more about how we can reduce our cancer risk and then help people actually take the steps in their everyday lives to do it. So it's a very important mission. But we also think it's a very empowering one because it really shows that we have some level of control over our own cancer risk through our lifestyles.
Can you provide a snapshot of the American Institute for Cancer Research today in terms of years of research, the money invested in research, some of your studies, and the people that are reached yearly?
Sure. Yeah, I'd be happy to. We're founded in 1982 and we've been funding research since 1983. So since that time, we have invested over $110 million in cutting edge research. And this research is done at hospitals, it's done in laboratories, universities, across the US, different institutions. And it's a really critical part of driving the research that is going to answer these big questions about how we can reduce cancer through our lifestyle. By our count, we think that's just shy of 800 studies, individual studies that we've funded. We've published 3 expert reports, which are comprehensive reviews of the science in our field. They take into account the global evidence in cancer prevention and survival. Our first one was in 1997, the second in 2007, and we published our third one in 2018. And I've had the privilege of working on all 3 of those reports, and it's been a remarkable experience working with significant experts in this area. We currently have 17 scientific reports on 17 different cancers, and that provides our supporters and the general public with specific information on the cancers that they may be interested in. So that's really kind of some of the research snapshot numbers. On the education and communications side, we work with scientific experts and healthcare providers to create community resources. And we've invested over $68 million in cancer risk reduction programs and services over the years. So we do that by providing education resources, education programs. Some of those are online, some of those are in person. And we've connect with about 3 million patients, families, caregivers a year. We partner with about 75 organizations a year to spread the empowering message that we have some control over our cancer risk. This is usually through annual campaigns. We have a wonderful annual Cancer Prevention Month campaign in February, and we're delighted that so many organizations choose to support us and partner with us then. We get about 5,000 news stories about AICR and our mission every year. We have over 50 free resources available for the general public, for health professionals. And every year we distribute over 1 million newsletters to households that are packed with great information about nutrition, recipes, how to be more active, as well as uplifting stories from cancer patients and survivors. Latterly, what we've done is transferred a lot of our programs from kind of print-based format to online tools. We have some innovative resources, and over 20,000 people over the last 2 years have committed to changing their lifestyles by using these resources. And more we're seeing health professionals, registered dietitians, nurse practitioners using these tools in their community areas. So we're very excited about that. That gives you just an idea of some of our numbers.
And so what are the primary preventative measures that AICR recommends?
One of the things that defined AICR very early on was our commitment to funding the research, but also putting what we know about cancer prevention into action. And that continues today. So it's very important to us that the resources we put out for the public are based on the latest evidence. And that's the commitment through the expert reports. The blueprint that we have currently, we call it the Blueprint to Beat Cancer, we think is the most reliable cancer prevention advice currently available, and it consists of 10 recommendations. And I have my little handy tool to help me prompt these. Before I share these, I think it's important to note, because this can seem overwhelming to some people, that following this advice has the greatest potential to reduce your own cancer risk. And independent studies have shown that the more you can follow these recommendations and the more of these recommendations that you can follow, the greater potential you have for reducing your own risk. We're also very understanding that it's easy for us to list this evidence. And so that's the second part of our education work, where we really try and help people focus on, how do I do this? How do I get into action? The first recommendation is be a healthy weight. We know that having overweight or obesity is linked to 12 different cancers. So that is a critical part of our blueprint for cancer prevention. The second is be physically active. Be physically active as part of everyday life. That doesn't mean you have to spend hours in the gym. It just means get up and move more and more often. And I think what's so interesting about the research on physical activity is that it's becoming more and more compelling that this is a critical part of the blueprint for cancer prevention, but it's also a critical part for cancer survivors. We're seeing more and more studies coming through that the more active survivors are, the less chance they have of a recurrence of their cancer. Being physically active is linked to 3 different cancers. The third recommendation is eat a diet rich in whole grains, vegetables, fruits, and beans. So this is essentially making a plant-based diet your focus, and making that the core part of your dietary pattern every day, day in and day out. The next one is limit consumption of red and processed meat. We don't say don't eat red meat, so that does set us aside from some of the other groups working in this field. But we do say eat no more than moderate amounts. And moderate amounts is between 8 and 12 ounces of red meat a week, which is sort of 3 medium-sized portions a week. We do say reduce your risk of processed meat. That does have some carcinogenic compounds in it. The next recommendation is limit consumption of sugar-sweetened drinks. We advise people to drink mostly water or naturally flavored unsweetened drinks. Increased consumption of these kinds of beverage can lead to increased weight gain, which leads us back to the first recommendation. The next one is really important and often controversial. It's limit alcohol consumption. The evidence on alcohol and cancer risk is very, very strong. And really for cancer prevention, we say you're best not drinking. If you do choose to drink, we say definitely no more than 1 drink per day. And you may have seen there's been a lot about alcohol and cancer in the news recently. The next one is do not use supplements for cancer prevention. Now, it's important. We're not saying don't use supplements for other things if you've been recommended by your health professional to take it for something else. But we do know that taking supplements really has very limited impact on your cancer prevention risk. What's important is eating this dietary pattern that we're talking about, a whole plant-based whole grain diet. The next 2 recommendations that kind of round out this blueprint for cancer prevention are specific. One is for mothers, breastfeed your baby if you can. We know that breastfeeding offers protection to the baby itself, but it also offers protection to the mother who's doing the breastfeeding. And then finally, after a cancer diagnosis, follow these recommendations if you can. It's sometimes overwhelming for cancer survivors once they've come through, really pretty brutal treatment to then try and get on a path to a healthy lifestyle. But it is one of the most important steps that they can take. And more evidence is coming through. And actually, sometimes this is the critical turning point in someone's cancer journey, that they feel that this is the way forward for them. So we encourage people to follow as many of these recommendations as they can.
I rarely have 100%, but I have a 10 out of 10 on those recommendations. So let's talk a little bit about your responsibilities as Executive Vice President and Senior Vice President, President for Programs and Strategic. What are your primary responsibilities?
Well, firstly, I'm responsible for the day-to-day running of the organization. So that means making sure that all our departments and staff have everything they need to function, that everything operates smoothly, that we're resourced well enough to meet our mission, and we're working towards our objectives and goals, and making sure that we're keeping to our annual plan and budget. I think the second part is really looking ahead, making sure that we're planning for the future. So it's kind of having one eye on the present and one eye on the future. I think if anything, we've all learned from the last 18 months that every organization needs to be in a position where it's agile, where it can pivot pretty quickly to what's happening in the external environment. And to be able to do that, I think you need a solid organizational framework that can respond to the different pressures. And that takes time. That takes time and effort to make sure you've got the right people in the right place. You need a great staff who are committed to the mission and their colleagues. And you need a great sense of humor to make sure that you're equipped to meet the challenges of the future.
AICR was founded in 1982 at the time of the National Academy of Sciences report, Diet, Nutrition, and Cancer. Can you provide some highlights of the history of AICR?
I think it's so interesting to look back and see how far we've come, because it's hard for people to imagine now that in the 1980s at that time, there was so little belief in the idea that diet nutrition had anything to do with cancer. And so as a result, there was very little support for scientific research or creating public awareness. So now when you see how far we've come, it truly is amazing. The debate isn't about how much nutrition and physical activity impacts cancer risk. It's more about how it impacts it. It's more about how can we create personalized recommendations for people. So you mentioned the National Academy of Science report, and that was the critical launching pad for AICR. It gave us our scientific evidence base at that time. It was compelling evidence, but it was small. So one of the early goals was to make this report public. We printed 50,000 copies of this report and sent it to scientists across the US. So if you think back to the 1980s, that was a big job, just condensing it and printing it. We also published the first dietary guidelines to lower cancer risk in the New York Times, and that created quite a stir too. So really in the 1980s, we got busy funding research because there wasn't enough out there. At that time, the research was more reductionist and focused on individual food groups. So we invested in scientists who were looking into soy. That was a very productive area of research then, and also into broccoli and other cruciferous vegetables. Then fast forward to the 90s, once we'd really been funding research for a while and we're learning more and more, we had our first annual research conference where we brought scientists together to share the science that they were working on, learn together, and collaborate more on future research. At the end of the 1990s, we realized that there's so much more research had been funded. The NAS report was really out of date and we needed to produce another expert report. And that led to our first expert report in 1997. The year of the 2000s, we really focused a lot on our education work. We launched the New American Plate, which was a kind of novel way of looking at how you can start eating a plant-based diet. The focus was very much on changing the balance between portions of plant-based foods versus animal-based foods, and the portion sizes to help reduce cancer risk. Then in the 2010s, we produced our second expert report, and we did a lot more face-to-face seminars work with the public. We held seminars on how do people reduce their cancer risk in different cities around the US. Then finally, we published our third expert report in 2018. Over the last few years, what's been most critical to us is kind of transferring from a print-based organization to an online-based organization. So we launched two very important tools. One is called the Cancer Health Check, which helps participants assess how their lifestyle choices stack up against our 10 cancer prevention recommendations. And then we have a Healthy 10 Challenge, which goes a little bit deeper. It's a free online 10-week program that's designed to help people improve their diet, nutrition, and physical activity. It takes them into each of the recommendations and shows them how they can start implementing it in their own life. So it takes them deeper.
And AICR's research initiative is called the Continuous Update Project. Can you tell us about that program?
Sure. So I've talked a little bit about our expert reports, and these were really important to publish in 97, 2007, and 2018. But it was around 2007 when we were published the second expert report. We realized that we really needed to be doing this on a continuous basis, hence the name, Continuous Update Project. So we wanted a system that allowed us to review all the evidence that was coming out, because there was just so much more of it, on a systematic basis, with a strong methodology, and an independent expert panel that would then review all that evidence. So we set up a central database at that time to house all the relevant data that we were collecting and analyzing. And as researchers around the world published new studies, their work got added to the database. Then when we were ready to review a specific cancer site, we would systematically review that and would bring together an expert panel that would then make judgments about the science. So essentially, our 17 different reports on 17 different cancer sites is the Continuous Update Project in real life, in process, if you like. It's an ongoing program that analyzes global research on how diet, nutrition, cancer, and physical activity affect risk and survival. I should say one of the key things that I missed out on our landmarks as an organization was that we have an international part of our organization, the World Cancer Research Fund, that was founded in the 1990s. And the Continuous Update Project is done in collaboration with the World Cancer Research Fund International, WCRF. And that allows us to have much more leverage worldwide and work on a global scale.
So what is on the roadmap for AICR?
The roadmap? Well, this is it's a really exciting time to be engaged in this work. I think the quality and quantity of the research being done and being funded, not only by us, but by other agencies, is really, truly remarkable. And the progress that's been made is very, very encouraging. I think I'm going to mention the pandemic again. The last 18 months have clearly been very difficult on many levels. But one of the outcomes that is slightly encouraging is that it's kind of shone a light on how important good health is. And I really hope that message continues and people do start paying attention to their everyday health, in the fact that it can help you withstand ill health and things like the coronavirus. So our commitment for the next couple of years certainly is to continue with the cancer research, keep expanding the scope of our research into new areas, increase our work in communities, and we've started doing more policy work. We want to advocate for broad changes in systems-wide, particularly with the health insurance system for cancer survivors. So one of the specific areas on the research side that we're interested in is supporting survivors of childhood cancers. How can they live a healthy life through adulthood? What's the lifestyle that's going to best serve them to reach a healthy adulthood? There's a growing body of research on this. It's relatively new. We're actively involved, and we think this is really important work, looking for what the best advice is for this group of people. In terms of the communities, we want to make sure that communities are using the tools that we have, Cancer Health Check and the Healthy 10 Challenge. These are designed to be used in communities, and so we're working with doctors, with dietitians, with nurse practitioners, so that they can offer these programs in their own localities. We really want to reach people where they are and working with their local services. In terms of advocacy for cancer survivors, once cancer survivors are through treatment, they're often left on their own to their own devices. And that's a very critical time when they need more support. In particular, they need nutrition counseling and access to physical activity specialists. None of these services are currently covered through health insurance. And so one of our future goals is to really advocate along with other groups to get that kind of resource covered. It's post-treatment is just as critical to long-term survival as getting through the treatment itself.
want to thank you for your time and sharing your important work that you're doing at AICR. I appreciate your commitment and joining us today on this interview. Thank you.
Thank you very much.